Hello, everyone. Happy Deep Dive Wednesday. And by now, you should know what that means. This is the day when we delve into this pandemic and really work to deepen our understanding of coronavirus and the disease it causes, COVID-19, and get your questions answered. This is the time where those issues, those problems you've been wrestling with, we bring them to the experts. We bring them to these learned people and hope that they will bring some clarity to this very confusing time. And on this Wednesday, we have a very special treat for you. We have not one, not two, but three doctors who were on the front lines of battling COVID in New York City, and they are here with us to talk about the reality of treating patients with COVID and all that they faced in New York and what Africa could learn from their experiences. They are here to share all of this with us. You know how this works. This is an opportunity for your voice to be heard, for you to put your questions to these experts. So we only have an hour. We want to make sure your voice is heard. Get writing right now. Let's get started. So as the months roll on, coronavirus continues to wreak havoc around the world in our day-to-day lives. Nothing is simple anymore. Every interaction has to be thought through. There's no such thing as a simple hug or a simple handshake or a kiss. Everything is so much more fraught these days. And even though so much time has gone by, the reality is our understanding of coronavirus, of COVID-19, is still pretty limited. And day to day, what we thought we knew can shift. And that's why we are doing this Deep Dive Wednesday segment as part of Home with Isha Sesay, because we understand the need for good information. We understand the challenges we have in just getting hold of the facts. And this is why we're doing this extra special show for you with three doctors from New York City who were on the front lines battling this epidemic, this outbreak as it took place in the US. And as you will recall, New York was indeed the epicenter of the US outbreak. Let me introduce them to you because they are here to answer your questions and anything you are wrestling with. Please welcome Dr. Sylvia D'Souza. She's the chair of the Department of Emergency Medicine at the Brooklyn Hospital Center. Dr. Adebanke Adebayo, the Administrative Chief Resident of Emergency Medicine, and Dr. Olaitan Lola Ajisafe, a third-year Emergency Medicine resident at the Brooklyn Hospital Center. All three of them have family on the continent. All three of them care desperately about Africa and are watching closely what is happening there, and will share their perspectives on what we are facing. Doctors, welcome.
Thank you. Thank you for having us, Aisha.
It is good to have you with us. It is so important. Our viewership has already shot up, as we can see from Facebook. Dr. D'Souza, Sylvie, let me start with you. Take us back to the height of the battle, if you will, against coronavirus, against COVID in your hospital, the Brooklyn Hospital Center, a couple of weeks ago when you were working around the clock and really you were in the middle of the war. Talk to me about what stands out for you from that time.
For us, it really started at the beginning of March because we in the emergency department started preparing from March 3rd. The first case in New York was on the 1st of March. By the 3rd, we realized we needed to prepare. We didn't know what we were preparing for, to be honest. And we didn't have much information. Most of our information was coming from WHO or the CDC. We had no guidelines from our local Department of Health, but we felt the need to prepare. So what did that mean? We needed to gather as much information we could from what was happening in China, what was happening in Italy, from the CDC and those sources, assemble a team that would be available and ready to respond. Also to develop a plan, really. You need to have a plan to tackle whatever's coming your way. And as emergency physicians, this is what we do. So we put all that together, and a lot of it was based on what we learned from the H1N1 crisis in 2009. To be, we utilize a lot of the same skill sets, and we developed a log, we developed protocols, and then we sort of waited. And as the days went by, we also felt the need to identify a specific area of our emergency department to be able to separate really the patients who came in with what we thought was a flu-like illness, a fever, a cough, from the rest of the patients. Because very early on we realized there was a need for that separation to avoid the spread of the disease, to also avoid exposure of the staff or other patients who are here for non-contagious sort of illnesses. So we put all that in place, but every single day it seemed like the volume doubled. So whatever space we identified initially, we had to expand and expand. We eventually even put a tent outside of our emergency department to sort of debulk some of the volume. So a lot of it was the challenge that we faced. A lot of it was dealing not only with the illness itself, but also dealing with the anxiety that that was spreading like wildfire in the community. People who thought they were ill or they were exposed. That was just as challenging as actually dealing with the illness itself. And then, of course, yeah, go ahead.
I just wanted to jump in and give our viewers some context as to typically the patients you see. A lot of the patients that come to Brooklyn Hospital Center, they're minorities, they're black and brown, low socioeconomic residents. I mean, talk to us about, the community you serve, so we get the context of that and the resources you have as a hospital.
Right, so we're a community hospital, as you stated, and we serve a community that's very diverse, but caters largely to the underserved, folks who don't have access to healthcare, and everybody else, let's put it that way, because, the community is changing, but the majority of our patients are folks who rely on us for their healthcare. Some of them are insured, some are uninsured. But certainly they depend on us for access to healthcare. We're the doorway oftentimes for the community we serve. So yes, of course, it's the black and brown community. It's also the elderly. It's the diversity of the patients we serve, I think, is what really distinguishes us from other hospitals. I think because of our location in downtown Brooklyn. We serve, a very diverse population. So the initial phase, right, as I said, after we prepared, we really didn't know what to expect. And as we saw the volume come into the emergency department, increasing, almost doubling every single day, we adapted. And then also as we saw the severity of illness increasing every single day, again, we didn't know what to expect, but we learned as we went along, and as much as identifying the illness, but also in choosing treatments. This was a continuously evolving situation where we had to learn as we went along.
So let me jump in there and just ask our viewers to please start sending in your questions for the three doctors who are here with us. We want your questions for them, whatever you're dealing with. And as you write your questions, please tell us where you are in the world. Give us some context. Sylvie, excuse me. Let me bring in Dr. Adebayo. As Sylvie talks about the severity of the illness increasing every single day. Can you speak to that? And one of the things that struck me, and I think everyone, about coronavirus, about COVID-19, is its multiple impacts on the body and how quickly people's conditions can change. Can you talk to some of that and what you personally saw? So the audio. So we can barely hear you. So I'm going to ask you to really, really dig deep and project.
Okay, so initially it started off, like Dr. D'Souza said, it started off as one patient, and then one patient became like 5. Then 5 became 20, and then it just became overwhelming. And so each time, like initially we thought it was just like fever, cough, sore throat, and then it slowly evolved to like lack of smell, lack of taste. People were complaining of headaches. People had like they were vomiting, they were having diarrhea, and that all was a part of the COVID-19 symptoms. But initially, we didn't have any idea. We just thought it was just a viral or respiratory disease. And so that changed the way we looked at patients. And as she said, we separated the patients, but it became harder because the symptoms were evolving with the disease itself. And so treating the patients became like mentally taxing, because you each time you would question yourself, did I really screen this person properly? Could it be COVID? Like something that didn't seem right. It didn't add up. Like a viral illness, you should have like fever and maybe have a cough, but then somebody might come in with their leg swollen and have like a blood clot. Then we started to see like pulmonary embolisms, which are blood clots in their lungs, and patients were having strokes. Those who were diabetics were like having high blood sugars, and that started to make us think like we really were starting to feel less in control of treating patients with the virus.
And so as we do this, because we are the two of you, Dr. Isha Sesay and Adebayo, you're sharing the computer. So as you guys speak, if you'll center, I guess, to hog the camera so we can see all of you. And you both have Nigerian roots, so really lean into that volume that I know you were blessed with. Dr. Adebayo, you were just talking about the multiple effects. Dr. Isha Sesay, let me go to you there. Talk to me about the fear piece, and then we're going to start getting these questions in from the viewers and their comments. Talk to me about the fear. Dr. D'Souza just talked about that you're also dealing with the fear amongst patients, and I'm sure fear internally amongst the staff. How was it for you watching the situation slowly accelerate and the feeling of not being fully in control of it?
So first in the beginning, seeing the patients come in, they come with flu-like symptoms, fever, headaches, things we initially thought weren't entirely severe. So we started triaging the patients, where we decide, okay, if you're not extremely sick, you can still breathe, you can go home. But very quickly we realized that a lot of the patients would de-escalate quite quick. So we'd have someone go home one day and then come back and nearly needed to be intubated. Also, the way it worked, we found ourselves admitting a lot more patients on a regular shift. So very quickly we're admitting patients, and within hours, they need to get ICU care. And so looking at that, particularly for us as emergency room physicians, we do see a lot of sick people, but the volume of sick people literally tripled every day, where people are at the point where we didn't know if they were going to make it or not. And then starting looking at the staff, so we have like a 4-year program. We have, first year interns who are not quite used to the system of things. They began to see a lot of sick people and possibly a lot of people dying. And we found that quite intimidating and worrying. So within that period of time, we began to start doing things like getting online servicing for site care, just to make sure that, yes, you're seeing these things at work, but how's it affecting you? So the system was overloaded both by taking the patients and us on the other side who were also overwhelmed the amount of people who were really sick, who couldn't be properly taken care of at home.
I remember watching video from your hospital, the height of the outbreak there in New York. I remember, Sylvie, seeing you on various news programs. And Dr. D'Souza, talk to me about the importance of PPE to the fight against COVID, and in terms of healthcare workers keeping themselves safe. And really what I'm getting is how infectious this virus is.
So, yeah, this is a very infectious virus that certainly we've never seen the likes of this sort of contagious virus in New York City. This was the first time. The only other time was perhaps when there was Ebola, but it was a few isolated cases, nothing on this level. I mean, this was on a massive level, dealing with a very infectious virus, with also that had extremely lethal manifestations. So the PPE was essential to be, to protect ourselves. In spite of this, we some of us did get ill and had to be taken out of the treatment area, had to stay home for the most part, and luckily most of us recovered fully. But I think that we've never seen anything like this in our lifetime. We've been prepared for many disasters. We've dealt with many disasters, including 9/11, train derailments, Sandy, Hurricane Sandy. A lot of us have a lot of experience with disaster preparedness, have special training, but I don't think any training could have prepared us for this virus and the way.
Did you have enough PPE at your hospital?
We did. We were lucky enough to have enough, not only through the hospital's procurement, but also through donations. We had, a massive rallying of the community around us, who really supported us and sustained us. Really, every time we ran low on anything, we had donations from the community, also from people from across the world, across the United States, they would anywhere, China, Korea. I mean, we received massive donations of PPE, and in that sense, we were blessed because we're a community hospital. We don't have a parent organization where we can run to get more stuff. We have to sort of, figure out things on our own. So we were very blessed in that sense that we never ran out. But yeah,
that is tremendous, considering everything we heard about the rush for supplies. This question from a viewer, from Manly, who's writing in from Liberia, and I'm going to put this question to all three of you.
Sure.
How is it to balance life with your family now that you have to be extremely careful with your interactions? And just generally, he's asking about your mental strength. Manly from Liberia wants to know about balancing life, your work life with family, and just obviously the dangers of dealing with this infectious disease, and just mentally how you're coping with it all. Whoever wants to go first, all three of you should weigh in on that.
Ade, you want to go? Ade, do you want to speak about it? Lola, right, go ahead.
I don't have children, so but it was different. I live at home with my mom and my.
Can you sit up and
lean forward because we can't hear you? Yeah.
Yes. Perfect.
Yes. Okay. So for, can you see me?
Yes.
Okay. So I don't have children like Dr. D'Souza and Lola, so it's very different for me. I worried about my mom, who is 60 now, and we worked an extreme amount of hours, and I didn't want to expose her. So I had to have a system at home in which I got undressed at the door, left all my clothes at the door, ran upstairs, take a shower, and then for like months, from the start of the pandemic, at least when we first admitted the first patient, till I think it was Mother's Day, I hadn't hugged my mom.
Oh, wow.
I didn't want her to be exposed to the virus. I didn't know what I was carrying on myself. And at the time when they kept talking about asymptomatic carriers, that worried me a lot too as well, because I didn't want to be exposed to it, not have symptoms, and then give it, because that would be devastating to me or to my family, that I felt like I would be the one that exposed her because no one else was leaving the house. So that changed, and then you don't see any family. And then like with significant others, I think it all depended, like we just made it like if I got sick, you had to stay by me, like you just had to be around me, and if anything happens, like we took precautions like showers and like making sure we isolated food, but you can't say, I'll sleep in a different room than you, or because you need that comfort as a human because of all the devastation that you were seeing. So you had to weigh in on what was more important. And for me, it was the human side and making sure that I protect my family, but still make sure I take care of myself mentally.
Yeah, that's so tough. There's a little rustle on the sound. I just want to make sure that it's not troubling everyone, and see if it's stopped. Okay, I think it has. To both of the other doctors, I mean, can you speak to that? Just how you adapted your lives and balanced everything?
Yeah. So I have 2 children and an elderly mother. My mother's in her 60s. And so what I chose to do initially was to stay at home. But what I would end up doing was typically just same thing she was doing. Before I go into the apartment, I'd make sure I changed, had a shower before I hugged my kids. But my concern was also for my mother, because in the beginning, there was a lot of talk as children were really affected severely. So my concern at that point was my mother. So I definitely wasn't hugging her at all. And they got to a point where I did feel like I had the symptoms. And that's when I actually went to stay in a hotel for a period of time until I got tested. The results came back negative. Then I went home. So what I've been doing in between this time is going back and forth between a hotel anytime I wasn't sure. Because you could be an asymptomatic carrier. And with each shift, I'm exposing myself to getting infected. So anytime I have some concerns, if it's a tickle in my throat, I've got a headache, I don't feel quite like myself, I'll go back to a hotel and stay there for a couple of days. And even during that period of time, even with the precautions I took, my mother did get sick. She was negative at the end of her hospital stay, but she was still in the hospital for about 4 or 5 days. So I'm still kind of going back and forth between a hotel and home.
Dr. D'Souza, can you talk about how it impacted your personal life and just mentally? Silly, can you unmute? There you go.
You hear me? Okay.
Yes.
Yeah, I mean, certainly certainly all of us have gone through this anxiety, and I think even more so now that we have more time, now that the crisis is slowing down, I think we have more time to reflect on what we've gone through. I think a lot of us are having trouble sleeping. My colleagues I speak to, all of us also have maybe perhaps trouble even talking about, what we've just gone through. I mean, we barely have had time to digest emotionally, psychologically, everything we've seen, all the pain, the suffering, the isolation. And it's also difficult to share that. It feels almost very private because we were there in the most private moments. I mean, when somebody dies, you know they want to be with their family, and a lot of them, most of them actually, could not have that moment with their family. So we were the ones there sharing their last moments, and I think just that alone feels very intimate. We almost feel we need perhaps time to sort of digest that before we can even share that. I mean, at least that's how I feel.
Yeah.
And then, obviously it will take time, and I think it will take perhaps some counseling. I think all of us can probably benefit from counseling. In terms of the isolation from the family, I mean, all of us, I mean, Lola and Ade touched on it very well. We all took precautions to protect our families. My father's in Benin, so I don't have to worry about that. But, I have a husband, I have a son, a grown son, but nonetheless, he was staying with us. So he went to stay somewhere else. My husband chose to stay with me, and I even offered to stay in the hotel, but, he wanted to just remain by my side, which I really appreciate, during this time, because I think the isolation is tremendous. But luckily, we have each other. Right, we're a very close-knit team to rely on. We can call each other anytime, and I think that's a really important part of it, having each other, because and this is why it was so important for me to sort of do this interview together, because we shared that experience together. It was something we went through together, and I think to speak of it, would be it would not be the same, if each of us, gave our separate account. This is
Yeah.
a shared experience. We wouldn't have been able to survive it without being a team.
I'm going to ask you, I've got a question from Demajuk, which I'm going to pose to you as soon as I get you guys to answer this question that I have. Listening to you guys recount the mental toll and the decisions you had to make for safety and safety of your loved ones, what was the worst moment in all of this for you guys individually? Dr. D'Souza, what was the lowest point, the worst moment for you at the height of this crisis? And then I'm going to get to this question.
I think, certainly the worst moment was watching people having to live their last moments without their loved ones. And, I can speak to that because I personally, my mom passed away in Benin, with she lived with my dad, obviously, but, I wasn't able to be there because she was 6,000 miles away. So, not being there is something that is the most difficult part about my mom's passing, not being there in the last moment. But then there, in our situation, we had people who were just behind the door in the waiting area. So it didn't matter if you were 6,000 miles away or 6 feet away, you couldn't be with your loved one. So I think that's the toughest thing for me to live through, because it sort of like took me back to what I felt when I was in that plane ride, the second plane to try to get to Benin, to see my mother and say goodbye, and I wasn't able to. And here we were faced with these hundreds of people, one after the other, each and every day, dozens, who could not be with their loved one and have those last moments. That was the toughest part for me.
Yeah, it's incredibly painful to even hear. Dr. Ajisafeh, Dr. Adebayo, we lost you for a second, so let me repeat the question. What was the hardest, the worst moment, the lowest point as you battled the outbreak there in New York?
I think for me, the first time I had a patient code. So like we were saying, with these patients, they de-escalate quite quickly. She had come in with similar symptoms, fever, cough, maybe some shortness of breath. Within 3 hours, we discovered her, what we say, unresponsive, and we had to do CPR on her. This patient never made it. And that was my first, because 1 hour, maybe an hour ago, she was walking around asking for a beverage. An hour later, we're coding her and she doesn't make it. She's in her 50s. So for me, that kind of stuck and let me know that we're fighting with more than one thing, because it presents in so many different ways.
I had two really, really low points. There was a day that I came in, I was having like my own personal issues, and I met Dr. D'Souza at the door, and we had a medical student, and he came over and he's like, Ade, my mom is satting, her oxygen saturation was like 81%. And like everything that I was going through at the time, like I like wiped my tears and I ran over to his mom, and I like saw his mom, helped him, everyone pitched in. We got his mom admitted. And then the next morning I left and I received a phone call that his mom didn't do well. And then his mom went to the ICU and she unfortunately passed. And it was just like one of us was gone. And like speaking to her, seeing her, she looked so well appearing. Like you would never know that something was wrong with her. At the same time, we had a coworker's husband. There was 2 coworkers, their husbands were in the same area. They both look well. And I said, just do me a favor. Make sure you keep your mask on. Make sure you keep your oxygen. Try to lay on your stomach. Try to turn to your side. I know it's uncomfortable. And they both didn't make it. And that for me was like life-changing at that point. So when I approached the rest of my patients, from the door. So we have this system where there's a resident in charge who runs our emergency department. And when I saw patients that came in with low saturations, we take them into a resuscitation room if they were really bad. And I changed my practice. I started asking them while they can talk, who do you want me to call? And for me, like we had a patient, I asked her, who did you want me to call? And she gave me a number. And I was just like, I need his cell phone number. And she's like, why? And I was like, I need his cell phone number. And she's talking to me and her oxygen saturation was like 56%. And so that's like, why are you how are you able to talk to me? I wrote down the number. We set up, she called her husband. He told her, I love you. And he said, do what you need to do for my wife. And then the next day she passed away. And for me, it was helpful that we were able to connect them because, like Dr. D'Souza was saying, I don't know them as well as the family could ever know them. And in that last moment, as a human, you deserve the right to be with someone that loves you. And the only way that we could facilitate that was through a phone call on a speakerphone. And that's the last time a lot of people saw their loved ones. And for me, it weighed on me very much emotionally because it was like, it just didn't seem fair.
Yeah. Yeah. It isn't fair. It isn't fair. And the reason we are doing this show, in particular with you, to speak to what you've been through is to help people all around the world truly understand the magnitude of this disease and how it has decimated lives and how everybody should be taking it seriously. And this is why I felt so strongly about having clinicians come in and speak to what they saw and the death that they saw and its impact. So people can not in any way say that they didn't get to really see this thing in all its horror. A question that has been put to us, Jennifer and Tengbe has asked, could it be that the coronavirus is airborne? So just in terms of how this thing is transmitted, can you just speak to that and what we know right now? Dr. D'Souza.
Sure. I mean, we know it is airborne. It's transmitted through secretions, which can travel, up to 6 feet or more, and it remains in the air for a while. It remains on surfaces for a while. The degree of contagion you can get from a surface has varied. Initially, they said it could last, 24 hours, 48 hours. Now we're really learning, as we go along that it's actually not as contagious as we thought from surfaces, but it certainly is contagious from close contact. What we consider close contact is we're coming within 6 feet of someone. So this really, sort of emphasizes the need for some sort of barrier. A mask at a minimum, I think, should be worn by all. I don't think we need to relax the precautions, no matter what the guidelines say, because until we really know that it's sort of dissipated worldwide, not just in the United States, I think we should maintain those precautions and the safe distancing as much as possible. Yes. So it is airborne. Yes, to answer the question.
Dr. Sesay, this question that Damajik wants you to just speak to a little bit more and just clarify, what does coding patients mean? What exactly does that mean?
So when we say a patient is coding, it means usually when patients come in, they have a set of vital signs we take. Normal vital signs, you're looking at blood pressure, you're looking at how their lungs are getting the oxygen, and you're looking at their heart rate. Now, typically, if a patient comes in and their oxygen levels are a certain level below a number we look at, that's a concern. That means we'll take the patient to a particular room and see if we can assist them with oxygen through a mask before we go any further. And other things to do, if their blood pressure is low, then we'll do other things to intervene. So it's just interventions we do before we actually get them to a point where we might need to intubate them or maybe kind of do resuscitation, CPR resuscitations. So it's just kind of getting them back to normal vital signs.
And then intubation would be to put them on a ventilator, am I right? To get
Exactly.
Okay. And we have another one, and everyone is just talking about how sobering what you're sharing is, and just how much it's making an impact on them. Julia Keta says this: I want to extend my gratitude and sincere appreciation to you all. Your heroic efforts to save lives in the moment is gradually paying off, and we will win this war. In your time of reflection, what advice will you share with us to prepare for the next wave? Dr. Adebayo, do you want to take that?
So to prepare for the next wave, I guess I would have to reflect first in the fact that as much as it seemed like we couldn't save as many people, we definitely saved a lot more. We had more success stories than we had casualties in this fight. What I would say is that initially we didn't take it very serious, right? And one thing that I wanted to address was, in the beginning there was like the little fun and jokes, and then we kept saying that, Corona doesn't affect Black people. Corona doesn't affect Black people. Until I remember very clearly, it was that weekend before they closed school. and everyone came in, and it was initially because the first patient we admitted was I was like, this person's not fitting the specs that we normally would have. Yeah. And then they became more and more, and they started to look more and more like us. And so you wondered what was going on exactly. And so I think tendency, as a culture, we like to enjoy, we like to have fun, but there's a time and a place. And right now, when it's threatening the lives of yourself and your family, we have to put aside that for the betterment or the success of our race. And so with that being said, I would say that, as Dr. D'Souza said, don't take it lightly. Still, the masks are annoying. They're more annoying to us because we have to wear them almost 14 hours a day, like a big mask. And then additionally, go outside and wear masks, and you just want to breathe. But it's better to be annoyed than to be 6 feet under. And that's how I look at it. Or to prepare for the winter, I would say, I personally, and Lola and I were on the same page. I load up on the vitamins. I think people should start taking taking charge of their health, right? It's super important. The patients that had comorbidities like diabetes, hypertension, they didn't do well, right? So we want to make sure that, those things are under control so that if you are fighting an infectious process, that your body is not under already a lot of stress at baseline because it's fighting diabetes or trying to maintain from the hypertension, that you are able to fight it if, God forbid, that you do contract coronavirus. Yeah.
I do want to ask you about treatment regimens, and Dr. D'Souza, this is to you. A lot of people who are watching, on the continent, as many of us have had malaria through the years, we've paid particular attention to the talk around hydroxychloroquine. Can you talk to us about your experiences with it? I know WHO has just suspended a study of it, but right. Can you reflect on hydroxychloroquine? And the studies have already shown it's not effective. It can have serious implications. But just what are your thoughts on this matter?
The treatment has evolved during this pandemic almost every other day, and changed, and so have the guidelines. I will give this question to Lola, Dr. Isha Sesay, because she happens to also be a pharmacist, so she can answer to those questions.
Okay, so initially when this pandemic started, there was word of hydroxychloroquine being of some assistance to maybe alleviating the symptoms or decreasing the viral load. When we started the studies here on patients, what we noticed was if there was any slight improvement, the toxicity of hydroxychloroquine overrode everything else. And so we combined it with azithromycin, which also brought something into the picture, but the combination of the two created what we call heart arrhythmias. So very quickly, within a few weeks, we realized that wasn't helping. The next thing we brought into the board was remdesivir. That's an antiviral agent. And that was also meant to maybe help bring down the viral load. So far, there has been some promise, but with the patients getting this, they have to get a special authorization. So it's still what would say phase 3 clinical trial. So we don't quite know if it's going to be of great benefit, but it has been of some benefit. There have been other agents that other people are trying out, like interleukin-6 agents, which are monoclonal antibodies. And those are meant to also work a certain way, but we still have those in. A lot of hospitals aren't putting those on patients yet. So we're trying to find out what's the safest thing and what's the most effective thing. So it kind of comes back to, helping your immune system fight this virus. And so what we're doing right now, even in ICUs, we're giving patients vitamin C, we're giving them zinc, because we're trying to help their immune system also fight back at this virus. So for now, and there's other things too. With COVID, we're seeing that it has a coagulopathy. And what that means, it makes your blood clot more than it usually would. So in a lot of patients, we're also giving them anticoagulants to help, because we're seeing patients who are getting DVTs, which is clots in their legs, clots in their lungs with the PEs. So we want to prevent that from happening. So we anticoagulate them first of all.
Anticoagulants is blood thinners.
Yeah. I want to put this question to you and to whoever it's appropriate, from Margaret Cole. Why does it appear that people who are put on ventilators end up dying? There was some reporting around this. I don't know whether it was borne out in your hospital, that actually ventilators could make the situation worse. Ultimately, I mean, I don't know. Can you decipher some of the reporting that's been out there around ventilators and mortality?
Sure, I can address that. Generally, we have certain criteria to put people on ventilators, life support, and they're largely based on numbers, right? I mean, certainly the patient's appearance and general condition, but certain numbers trigger a response that would make us act and put them on artificial respiration just to help support their breathing. And this is what we initially did because that's what we've been taught. And these are this is a standard of care essentially. But what we've learned in the course of the disease, that whole paradigm changed because we realized that some patients were able to ride it out, meaning ride out the low oxygen contents in their bloodstream just with high flow oxygenation, concentrated oxygen that we would just give them through, like a tube we put in their nose without putting them on life support. And doing breathing exercises, changing position. Some of them were able to ride it out and somehow turn the corner. And it seemed that those who turned the corner would actually survive and do better. The problem we had is that we could never predict who that was. Who would do better, who would be able to ride it out with just oxygen. So it became very critical to sort of monitor these patients very closely, try to delay putting them on life support as long as we could until they couldn't, breathe on their own anymore. And, finding that critical moment where we had to put them on life support, meaning a ventilator to breathe for them, was crucial and was essential. And that's something we learned from, when you're asking like how we're going to prepare for the next wave, that's one thing we learned from this time around. Certainly we know for sure that clearly those patients who were placed on a ventilator, on a breathing machine, did not fare well. And nobody really has, all the answers. You can't say it's necessarily because they were put on a ventilator. Certainly there's a lung injury that can result from being put on a ventilator. And some people are looking at that, but I don't think any of the studies are conclusive. But what we do know for sure is that all people who went on ventilators, of those, approximately, actually greater than 80%, did not make it, did not survive.
I didn't know the number was that high. I knew that it was the majority, but I didn't realize it was that high. It was that high.
Yes, it's more than 80%. So if you went on a ventilator, if your family got a phone call that you were going on a ventilator, we had that sinking feeling because we knew what that meant. That patient had very little chance of surviving. Of course, that is not how we put it to the families or to the patient, but we knew that, and we had that feeling.
Just for context, Sylvie, what percentage of patients with COVID end up on ventilators, at least in your hospital?
I mean, in the early phases of the peak, the earlier phase of the peak, I'd say of the sickest one, I'd say probably about 50%. As we went on, we tried to sort of avoid putting them on ventilators as long as we could. So, the exact numbers are. I mean, we during the crisis saw approximately 2,500 COVID patients. So of those, some went to the ICU, some succumbed to the illness, and like Alice said, what we have to remember is that the majority survived, even those that were very ill. And that's what we have to remember. It's just those who got to that critical stage, obviously, the prognosis was not very good. But there's a lot of things we learned about how to manage the ventilators, even when we put them on ventilators, and then treatment options. Convalescent plasma is another option that we've had recently of people who've recovered and donated, and that's something we use on the sickest patients. Do we know exactly if it works? I don't think the conclusions are out yet because the studies are still ongoing. But we have nothing else, so that's what we do. Yeah.
Wow. This question from Martha Sesay, what advice would you give to Black, Asian, minority health workers as we suffer the highest death rates? Should there be a second wave?
I certainly think that it's to be, if you talk about the United States, I think it's certainly to be expected, just because people seem to have a very short memory span. I think that what worked in slowing down the crisis is the social distancing, the precautions. People followed them in New York City, at least. And that's what got us out of being the epicenter of the world, practically. I mean, we had the highest number of deaths of anywhere. Now, I mean, it's moved on to, Brazil, Ecuador, and other countries. But I think what got us out is the social distancing and people following the stay-at-home instructions, the wearing of the mask. But I think that as the weather gets nicer, people do not see as much, deaths. They haven't seen what we've seen. So the measure, they're relaxing, and they're not wearing their mask, or they're agglutinating in like groups in the park when they, really should. I think they should maintain those precautions at least till the fall comes around, so we see what happens. Because unfortunately, like either Ade or Lola pointed out, there's a lot of asymptomatic carriers, and they're just, if they don't wear their mask, they're spreading the disease.
Yeah, and let me jump in right there because there's a question on this. Desmond kind of wants some help with this, and I think it's a great question. Desmond says, I need clear explanation between symptomatic and asymptomatic, as this is what our officials involved in fighting COVID-19 confuse us with. So can we just speak to that, Lola, or
I can just say a little bit about it. So when we say it's asymptomatic, that means you're walking around with no complaints. You're feeling normal, but you're carrying the virus on yourself. And if you come into contact with someone who might be immunocompromised or someone's a little older with pre-existing conditions, they could get that virus and then become sick. And so you're going into the public unknowns to you and spreading that virus to different people. When you're symptomatic, it could be something as simple as loss of taste, loss of smell. Then some people go up. You're talking about fever. You're talking about a cough. And one of the more extreme symptoms that make us worry is the shortness of breath. And that's when we measure your oxygen saturation. So when you manifest with something, then you have some concerns. You'd be more careful. But a lot of people don't have any symptoms at all and could be one of those people sitting down without a mask or sitting in the park, but they have the virus. So that's the main thing. You don't know you have it and you're feeling fine.
The other thing to be that was,
yes, please. Yeah.
Like we were saying earlier, people were calling only people with fever, cough, and sore throat symptomatic carriers. Yes. But if you lost your sense of taste and smell, you were in the public eye, you didn't have COVID, but you were a symptomatic carrier, but you just didn't know. And that's where I think a lot of the spread ended up happening too as well, because you didn't know that you had it because they had not officially listed that as a symptom. And so people weren't unable to say that they didn't want to come, they weren't able to get tested, and they had no reason in their mind to get tested. They just felt like the season was probably changing and this is maybe my sinuses, when it was actually COVID.
Let me ask you something that I say in response to a lot of people, and I'd love you to speak to this question of the fever. Because, in Africa in particular, there's a lot of, fever checking. And that's good because you will catch those people who are symptomatic and have fevers. But as you've just made the point, asymptomatic people, i.e. people who still have the virus but aren't manifesting the symptoms, will not have a fever, correct? And so it's not a fail-safe for us to be leaning on this whole issue of I'm taking fevers, I'm taking temperatures, and, no fever, so you're good. Can you just speak to that? Because this is a really big thing that kind of makes my blood boil.
I think a lot of the, I think that's what they're doing, particularly in Nigeria now, is one, they do check the temperature, but also they're also providing places to quarantine people who come in newly. So they want you put to the side for about 7 to 14 days, where if you have the symptoms or if anything else is going on, it will manifest in that time. And then they'll be able to check and say, you know what, you don't have the virus, then you may go into the public. So checking the temperature alone doesn't rule it out. But quarantining people to the side for that 14-day period is a little easier to at least put people to the side and decide who does and who doesn't have the virus.
But it's also just in day-to-day life, from Lagos to Freetown, as people go into stores and people are going around, I speak to friends all over the place on the continent, and they say, oh yeah, everybody's out and about. I mean, they take your fever, they take your temperature before you go into the store. Back to Sylvie's point and what the three of you have said, we've still got to be really careful because the taking of the temperature does not catch everyone.
There are so many people that I have known that had COVID that never had a fever. Or maybe they had it and it was so low grade that they didn't even experience that they had a fever. But they can tell you about their body aches, right? So if we really on the continent want to isolate or practice preventative medicine, then we need to ask more questions than just fever and sore throat. That's just not adequate enough to prevent the spread of that virus, because especially if you look at like when we're talking about the markets in Lagos, like how close everyone is. And if someone doesn't have a fever and then they just are asymptomatic, they lost their sense of smell and they just give someone a hug, that person now contracts it. And then that's how it spreads in the market. And that person is in the market selling cloth all day long and they're talking to all their customers, and that's how they'll spread it to that person. One person can spread it to so many people without even knowing. And it's just, even when we talk, the amount of saliva that comes out is, you wouldn't even imagine, because you feel like, I don't spit when I talk, but a lot of like viral particles fly all over the place. And hence why even the cloth mask, even though we're not, well, personally, I'm not for the cloth mask because I don't think it prevents enough, but it's better than not having anything on at all, because it can cause some kind of barriers to it.
Yeah. And this question, and thank you for speaking to this question of fever and temperature checks, because it's something that I talk about a lot with friends and family on the continent. And King Alamo asked this question: can you speak on efforts to target the body's response to COVID vis-a-vis use of anti-inflammatory and anticoagulant?
Can you repeat the question?
Can you speak on efforts to target the body's response to COVID vis-a-vis the use of anti-inflammatory and anticoagulants, which I guess is back to what you were saying about using blood thinners, and what are you doing with regards to anti-inflammatories? I mean, because there was all this question about paracetamol versus, I can't even remember what it was, or aspirin.
Yeah. It has been shown, because there was some questions whether you should use Tylenol or paracetamol versus an NSAID, which is like ibuprofen. So far, none of the studies have proven that one is better than the other in treating patients with COVID. Now, when we're treating patients with COVID, when we use the Tylenol and the NSAID, it's more for pain and fever relief other than actually targeting the treatment and infecting the virus. So the NSAIDs, the ibuprofen, the Tylenol, they don't affect the virus load. They don't affect the treatment regimen. Now, with the anticoagulation, that's more or less it's trying to help with the cascade of things that occur. It's not also helping the course of it. It's the medications that we're trying to find that will actually affect the virus and bring down the virus load. So anticoagulation, which is just thinning out your blood so it's not so thick, is simply just treating a symptom of the virus. The Tylenol is treating a symptom of the virus. The ibuprofen is treating a symptom of the virus.
Go ahead. Is somebody going to jump in, or maybe it was just an audio echo?
The anticoagulation, none of it, like as Lola was saying, none of it's actually treating it, right? So all we're trying to do is temporize the situation so that your body can fight it. So, if we take a test, like some people may be familiar, like a D-dimer, and that just shows like coagulation in your body. So when we give like the blood thinners to someone, we're just making sure that your body's already in a state where it can form clots. So what we're trying to do is put it in a state where you know that you're going to form clots, but make it harder for your clots to form in your vital organs. And that's why they put you on anticoagulants. There's no real, like Lola said, there's nothing really there as of this moment that's a miracle that's going to solve COVID-19 as of right now.
This question that is here from Mudupe, actually, Isha Sesay.
Hey, dude.
Hey.
That's family. That's family.
The question is to both of you, Lola and Ade. She says, why are we seeing such a different reaction to COVID on the continent?
Okay, so I
What are
think
your
a few reasons I'll postulate as. First of all, I think once they saw how the US and Italy were ravaged, they quickly shut down the borders. Secondly, initially people were quite careful. And so that happened. There's been some rumor about BCG, which is the TB vaccine, helping. That's still in clinical trials, so that's not it. But what I think most of all is, as you've seen, it first started in China, then it came to us. So it seems to be going through phases, Brazil, Ecuador. So who's to say that going into the continent, it might get worse later on? So I would caution them not to celebrate and say, oh, it's passed us by. I would say they should prepare. If nothing happens or doesn't get worse, great. But if it does get worse, then they will be ready for it. Because right now, I don't believe we have the resources in Africa to fight as hard as we fought here or even in China. So as of now, everything seems okay. They've got a few cases compared to us, but I would just say they should look at what we've done and then begin to prepare just for the oncoming thing that might come either now or later on in the year.
I also have a theory where I feel like the vitamin D levels may play a factor. If you look at it, African Americans probably have or Africans, brown people, black people, we have the lowest vitamin D levels of all, races. And there are studies now that are talking about the vitamin D levels. And it may be so in Africa that the vitamin D levels are higher because they get so much exposure to the sun. But that's just one theory, right? I'd rather stay on the cautious side, right? You don't want to have to prove the theory right or wrong. You just want to be on the safe side. And so now that we're seeing, like, everyone is just like, that's a New York issue, that's a New York issue. And so when it went from China, from Wuhan to Seattle, the strain that hit us was from the European side, right? And the cases that got into Africa were from the European side. And you can tell that from the genetic markings of the virus strands. And so they're still not in the clear. I feel like they opened up, and they're not so open, but they are open because they feel like, oh, if it's died down in New York, then it's probably not as bad in Africa. But they're just, like Lola said, that's just not a risk that they should ever want to take. You can't, you don't have enough doctors there. You don't have enough electricity, the ventilators, the medicines. We don't have anything here. So we don't even have anything to offer them there. So it would be better for them to just practice the social distancing.
Yeah, we are running quickly out of time, but there are two more questions I need to get in because it's just important, and this is something specifically asked. Emanuela Ndifoa, and I think it's important we get this in, says, what advice will you give to those suffering from diabetes and hypertension in moments like this from your experience?
I would say they need to take care of themselves, because what I saw was a lot of people who were predisposed to getting it weren't taking care of themselves. They're not taking their medications, blood pressure medications. It's a silent killer. So if they don't feel sick, they don't take their blood pressure medications. They're diabetic. They're not taking the medications. They're not following the diet. So they should be doing exactly what they're meant to do. And that will decrease the chances or make their body at least better able to fight a virus so they won't be succumbed by the disease. So it's taking care of yourself, boosting your immune system, sleep, hydration.
Thank you for saying that. Last question to all three of you. The pandemic continues. In your view, what comes next? Dr. D'Souza.
What comes next? I think there needs to be a realization that this is not over. This is far from being over. I think the briefing that took place 2 days ago from the World Health Organization, WHO, they had a Q&A session that was actually very enlightening. We've learned a lot about this disease. We've learned a lot about manifestations, which are uncommon, which can affect just every organ system in your body. We've learned a lot about treatments that don't work, treatments that may work, but we still don't know enough. One of my colleagues said that we have no magic bullet. The only thing that we have right now is preparation, being able, preparing, having a plan, because when the wave hits, it comes like a tsunami. it's more than any human being, any healthcare professional can bear or has seen in their lifetime. So being prepared for the eventuality is really important. Being prepared to have, if not all the equipment, just at least having a space where you can receive the sick, whether it's a tent, whatever accommodation you can you can create, because obviously the context is different in each country. I think it is very important, being able to having a plan, even if it doesn't come, if the wave doesn't come your way, then good, so be it. But if it does, at least learn, from reliable sources, gather the information now, and assemble a team of, healthcare workers, epidemiologists who can help and respond to the crisis, because only I think 19 countries have done that in all of Africa out of the 54. So assemble a team of experts, who will help guide the response with whatever means are available in the particular context. I think that's very crucial. Having a plan of attack, is and then continuing to not relaxing the social distancing as much as is feasible. I mean, like I just said, in the market, it may not be realistic, but at least wearing some kind of barrier, like a mask, any kind of mask, is better than none. Yeah, I think we really need to emphasize that, because when the wave comes your way, I think it's unbearable. The loss of life, the pain, the suffering, the psychological trauma is, no matter where you are or in the world or what culture, or I think it's just unbearable. It's more than words can describe. That's why, that's how I would answer that.
Yeah. Lola, I want to give you a chance to weigh in on your thoughts of what comes next.
I would say, of course, preparation, like everyone's saying. There's no vaccine that's working right now in the horizon. So it is the mask thing that gets on everyone's nerves. That's going to be our new normal for a while to come. Taking care of yourself. And I think for me, most importantly, is what's important to you. Family, people, the people within your close knit. That's where you're going to focus on, because things are going to be different from here on out till we know what else is going on.
I think we're so focused on what's next that we have to kind of live in the moment, right? Because when we entered into this year, we had no idea that that's what March or April would, have in store for us. So part of the things that we can do are to, like Lola said, enjoy your family, enjoy your time with your family. This is the time we're not, especially with the world being canceled, as I like to say, it's time to take back your health, right? So, bike riding, walking, running, doing something that keeps you active, I know, like, we always talk about, like, keeping our shapes and everything, but we can do that in such a healthy way. If you're a diabetic, if you're hypertensive, now we cook more at home, so we're not worried about the fast food. The fast life doesn't have to happen. We know what we're putting into our foods. So, there's no room for that anymore. In addition to being prepared for, like, having masks, getting ready, wearing masks, as annoying as they are, because it feels like you're suffocated, but it can be a life that you save in the future. So that's something that we just need to implement and know that this is the new normal for now, until someone or God allows, some kind of miracle cure or some kind of immunity throughout the world. But as of right now, it just seems, as Lola said, going in waves, and we don't know where the wave is going to next. And so everyone should still lean on the side of caution.
Yeah. I just want to share, we got a comment from one of our viewers who just said, the show is just superb and how much they enjoyed it, and that has been the overwhelming response from everyone here. So I want to thank you, Dr. Silva de Souza, Dr. Adibanka Adebayo, Dr. Olatunlola. I just have to thank you for the work you have done. Thank you for the work you continue to do. We are a better world for having you in it and for your service. So I just want to say thank you from my own heart and from all the viewers. Thank you for taking the time out to speak to us today. We're grateful.
Thank you for having us.
Thank you for having us.
Thank you. Please stay safe.
You too.
You too.
Thank you. I hope you took from that conversation as much as I did, and I hope that you'll go back and you'll share it with your friends and your family, and you will really think on what you heard about the experiences of these doctors and how the sight of people dying on their own continues to haunt them, continues to upset them, and just how we don't have treatments. We are just dealing with symptoms, but we're not getting to the underlying issue. Viral loads, there is no cure, there is no vaccine. All we can do is lean into what we have right now. It's wearing masks, it's maintaining social distancing, it is being cautious. Because as Dr. D'Souza said, when this wave hits, it's like a tsunami. And it doesn't matter where you are. When it hits hard. So please, everyone, take that to heart. Please share the information. Let's continue to take this seriously. That is it for today's show. But before we go, we want to leave you with a song from a Nigerian who's just been appointed UNICEF's National Ambassador, which is a role no one's had for 15 years. It's a song about coronavirus. It's a singer-songwriter and producer Kobams Asko, and he says the song is called We Go Win. It's a rallying cry. It's us trying to leave you with some hope, and also leave you with the facts. Thank you for tuning in today. We're going to leave you with this song, and we'll see you back here same time, same place. Be safe, everyone. Thank you. Bye.
My brother, my sister, papa, mama, and pikin. Corona, no big pass us. We go fight time, we go win. As long as we remember to always do the right thing. Wash your hands, love each other, we go win, oh. Corona, na the virus, we dey worry human being. E no get Lego, but e dey waka from person to person. But we fit beat time, we fit stop time, if we maintain good hygiene and practice social distancing. We go win, oh. No shaking hands with your neighbor. Blow them a kiss from afar. Use soap and water to wage war. Let's show this thing who we are. We are special, we're courageous, we are awesome human beings. We dey super, we get power, we can conquer anything. If we hear word and obey laws and exercise discipline. Wash your hands, love each other, we go we know. If it be like say you know well, like it's something they do you, and you feel say, you believe say, you get to see they do you, and your body no gree surgery, like it's something they do you. No let panic finish you, you go we know. Self-isolate for the sake of all the people that you love. Oh, don't go around spreading rumors, 'cause fake news won't help anyone. You are special, you're courageous, you're a caged human being. You too much, oh, you get power, you can conquer anything. Only if you hear word and obey laws and exercise discipline. Wash your hands, love one another, we go we know. My brother, my sister, papa, mama, and pikin. COVID-19, no big pass, we go fight and we go win. Just as long as we remember to always do the right thing. Wash your hands, love each other, we go we know.